teenage pregnancy rate in the community. And by the whole of 2009, I think there was actually nothing. The Naleru Senior High has been getting a lot of abortion cases, but since we started the program, according to the masters at the school, they are saying that the abortion rate has really dropped. But they used to come with a lot of pregnancies, wanting abortions, but now it's almost nil.
Because of this club, some of us have known the effect of it, and we are able to prevent ourselves from getting something like STD and other kind of diseases and sexual intercourse. And we also know that, if you can't abstain, you must use condom. If not because of help of this club, some of us don't know all this.
If you are suffering from syphilis, I can detect it. And gonorrhea too. If you are suffering from gonorrhea as a lady, I am able to detect it. And because of the club, last Mrs. Baba came here and taught us how if you are suffering from breast cancer, how you detect it. So now I am able to detect whether a girl is having breast cancer or not because of the club.
I used to use soap to wash my under. Now I know that it's not good. It gives candidiasis. I used to dry my pants in a dormitory. And through this club, I know that when I do that, the germs in will not die and all leads to infection. And I now learn how to live with my boyfriend, not to get pregnant, and some of the sexual transmitted diseases.
We also have gained other benefits like helping us in exams. Some of the questions concerning health they will ask, and if not the club help, we will not get any help from the teachers. They said that syllabus is broad, so they won't be able to teach and cover everything. So they limit themselves to the other part, leaving that one. So we gain some of these benefits. And the peer volunteers are an encouragement because they've been trained, they are able to counsel one another. We had cases where one were interacting with them at one of the meetings. One of them gave a scenario where a friend of theirs, his was trying to cause an abortion, and then came and he counseled her, and she was able to stop doing that. She just withdrew and then delivered the baby. So we thought that story was very encouraging. So that means they are able to do their own counseling when we are not even there with them.
One of the things that we clearly have been able to do is to remove the stigma around adolescents' involvement in reproductive health, and also drawing the parents to be interested.
May the song the Zulu little bit because mamma is over the sister. I am club poor, Matala, I am club poor, I young sing school about I him, they sing Yark Senka. So, maybe at Banada Hamboni, but I can't young animal because about top of school. So, by song the Zoom, so to my boat, Bapo Yangane, Balip, Suzanne, and Nervous Pa, or Barakapa, Titan Sabbath, like a pala in Bungo de Secala, the lower song the Zoo.
The adolescents are also becoming more aware of their reproductive health rights. So as a result of that, they are able to fight for their rights when the need arises. Cases of elopement and child marriages have gone down significantly within the project community since the adolescents themselves are able to fight for their rights.
I was one day sent when one Umar with his friends tried to kidnap and elope with me in order to forcibly marry me, but was stopped by some good Samaritans. It was a fearful moment for me. I couldn't concentrate on my studies, but thank God to my teachers who saw it and complained to AGDE partner, Catholic Family Reproductive Health Project, who reported the issue to the community chief. The chief then summoned Umar, sanctioned him, and warned the entire village against such act. Since then, Umar has never disturbed me. Formerly, I didn't know about the adolescent reproductive health issues until the coming of the project. Now, I know that I have to complete my education before I choose my own husband to marry.
Nila kanyati fulani tara kamunya ta'arama kadi kyanin kazilio sikadi so kanya ta'araw kanya fulante kadi kyanin ka obya sukurwa to chief wanda ndanin ka kaji kalon chief darge ntubulla kanji bangi sukurma sukuri bin ngonya sia ka timunda bu bangni ngombe sukurma ka nyala tal ama tubu darge ma nyanga ti bangi sukurma sukuri bin ngonya sia benma de kuman ho tepi anaw ne pam.
We are very grateful for the Adolescent Reproductive Health Project. Indeed, it has helped to reduce the rampant teenage pregnancy cases in this community. Before Barikisu's case, it was common to see pregnant pupils all over this village. As a result of her ordeal and the consequent punishment that was meted out to the young man, teenage pregnancy cases have reduced drastically in this community. With the support of our assembly member, we have even gone further to establish a regulation. So anyone who impregnates a teenager, especially a school-going adolescent, is fined 100 Ghana cedis. It has really deterred the people.
Why using what? Someone's blade. Someone's blade. Stop sharing.
A lot of experience was gathered from the first phase of the project. However, much was yet to be shared on documentation and sharing of the information. It is against this background that ACDEP decided to develop capacity building and documentation plan to fill the identified gaps. The capacity of some selected adolescents across the catchment areas of the project were built in basic skills in videography. With the new skills acquired, the beneficiaries were well equipped to document activities under the Adolescent Sexual and Reproductive Health Project, among others.
They know how to take photographs, like to take a video clip, and even the pass of camera, I did not even know pass the way I will handle it, and take a video coverage, I did not know, but now I've gotten to know.
Handling a camera isn't a problem for me right now, so I think it's a new development in my life. Yeah.
Locally, I think that the PHCs particularly, I think that we need to commend them for agreeing to do this, because it's quite a bit of a stress on their already limited resources of manpower, finance, and other logistics, because they have to move to the communities, and I think that's already quite a stretch. But they are doing this in a very committed way and finding very innovative ways to integrate this activity into their own program and own it. And I think that we need to appreciate very much. I think that we have had quite a lot of support from UNFP and PPAG in the program. PPAG has supported us with materials. UNFP has supported us with materials, learning materials for the adolescents. I think that this has been quite helpful in getting us to start up and use resources that are already there without having to create our own. It has given us a head start in the whole implementation process. Of course, our traditional partner in this program is CODE, and we've had quite a long collaboration, successful collaboration with CODE. And one of the things that CODE has always stood for in terms of their partnership with ADEP is to look at what are the innovative ways of reaching the poor, the rural communities with development work, whether it is in health or it is agri or in whatever. And I think that's where Code 8 stands unique in terms of looking at the rural poor in terms of their development assistance. And we've had quite a successful collaboration with Code 8 over the years. And I think we must appreciate this as one of our traditional benefactors.
Based on the great strides made by the first phase of the Adolescent Reproductive Health Project, a second phase has been launched and is expected to run from 2010 to 2012.
Some of the challenges we have now is where most communities are requesting that we extend the program to their areas as well. But at the moment, the capacity of the ACDEP member primary health care programs is not enough to extend the project to all the areas requesting for the intervention. So it is important that we collaborate with other partners, particularly the DHMTs, that's the District Health Management Teams, to extend the project to other areas. That's one of the strategies we want to employ in the second phase as a way of expansion of the program.
And I think the main focus there is to see how we can consolidate the gains. We do more documentation of the results. We bring the experiences through workshops and seminars to a larger stakeholders, particularly within the Ghana Health Service, and to also begin to see how we can get the Ghana Health Service strongly into the program. I think this is basically the strategy for the second phase.
Positive effects of the project on members of these communities is indeed immeasurable. Communities who, until the intervention of ACDEP, were faced with numerous challenges including teenage pregnancy, unsafe abortion, sexually transmitted infections and diseases, as well as drug abuse, are now breathing sigh of relief. Knowledge, they say, is power. Therefore, adolescents of these deprived communities are now well equipped with the requisite skills and knowledge to face the future chest out and shoulder high, so as to grow into a more responsible adults and contribute their quota to the development of Ghana to achieve her middle income aspiration.